Hi, my name is Brenda, and I am a Communicative Disorders Assistant at West Park Healthcare Center. Today, I'm going to talk to you about intimate relationships and sexuality after a stroke or brain injury. In this presentation, we will talk about what intimacy and sexuality mean, the impact of stroke and brain injury on intimate relationships and sexuality, strategies to connect with your partner, and other helpful resources. What do intimacy and sexuality mean to you? The terms sexuality or intimacy mean different things to different people. Some examples are attractiveness, self-confidence, closeness, compatibility, pleasure, passion, enjoying activities with someone, intercourse, love, marriage, and reproduction. Sexuality and intimacy are central to being human and are different for everyone. Sex, gender identity, gender roles, sexual orientation, pleasure, intimacy, and reproduction are different aspects of sexuality and intimacy. We experience and express our sexuality and intimacy through our thoughts, behaviors, beliefs, attitudes, values, practices, roles, and relationships. Your brain consists of different lobes that are responsible for different tasks. Depending on which part of your brain was affected, the challenges you may have after a stroke or brain injury will differ. Your stroke or brain injury can also impact your sexuality and intimacy. The frontal lobe is responsible for thinking, memory, behavior, and movement. The parietal lobe is responsible for language and touch. The temporal lobe is responsible for hearing, learning, and feelings. The occipital lobe is responsible for sight. The cerebellum controls balance and coordination. The brainstem controls breathing, heart rate, and temperature. If your brain injury affected your amygdala, a deep part of your brain underneath the lobes, you may notice emotional changes. Brain injuries may cause medical and physical issues, psychological effects, and relationship changes, which in turn may affect one's intimate relationships and sexuality. We are going to discuss the following topics: medications, physical limitations, fatigue, pain and sensitivity, arousal and erectile dysfunction, and incontinence. There are many medications that one might use after a brain injury. They include, but are not limited to, medications to treat blood pressure, antidepressants, anti-seizure medications, opioids for pain, NSAIDs such as Advil and sleep medication. It is important to speak to your doctor or pharmacist if you feel one of these medications might be affecting your sexual desire or interest. Do not stop taking your medications without speaking to your doctor first. There are many physical changes that can occur after a stroke or brain injury, which can affect your activity level. They include muscle stiffness, muscle weakness, loss of muscle tone, spasticity, and decreased endurance. These changes may impact your daily activities, which can include activities related to sexual activity and intimacy. People who have had strokes or brain injuries often fatigue quickly. This fatigue may not be helped by sleep or rest and can last from days to months or years. Post-stroke fatigue often improves with time. Fatigue in people who have had strokes or brain injuries affects sexual health more than in people who have not had strokes or brain injuries. After a stroke or brain injury, you may experience pain and/or increased or decreased sensitivity in your body. This pain or sensitivity may affect your participation in daily activities. It may also affect your sexual health. After a stroke or brain injury, the part of your brain that controls sexual desire or arousal may be affected. Common sexual changes that occur include lower sex drive, changes in arousal, such as the inability to be aroused or achieve orgasm, and erectile dysfunction. There are medications that can help with these issues. Speak to your doctor if you would like more information. A stroke or brain injury can have psychological effects. They include changing emotions, a sense of loss, a decrease in confidence, the onset of depression, and cognitive changes. There can be several emotional reactions to a stroke or brain injury. You may question why this has happened to you. You may have anxiety around being able to reconnect with your partner, have a relationship, and engage in a sexual relationship. You may feel ashamed of your inability to do certain things. You may feel guilty about how your stroke or brain injury affected your family. You may feel lonely and isolated due to less support from family or friends. You may grieve the person you were before and how you were able to function before the stroke or brain injury. You may feel sad about the changes you're experiencing. After a stroke or brain injury, you may experience a decrease in your confidence level. You may feel isolated or frustrated. Your body image may change, and you might feel unattractive or not like yourself. If you're having these feelings, you may want to speak to a doctor or another member of your healthcare team to talk about these changes. Depression is common after a stroke or brain injury. Symptoms of depression include a lack of energy, changes in sleep, a decreased appetite, and irritability. Depression can affect your relationship with your partner too. This can include changes in your sexual activity. If you feel depressed, please talk to your healthcare provider or doctor. Medications can sometimes be prescribed for depression. After a stroke or brain injury, you may experience cognitive changes. You may find it difficult to concentrate, remember things, interact socially, and communicate. You may notice personality changes or persistent behaviors or thoughts. These changes may impact how you connect with your partner or other people. After a stroke or brain injury, there may be relationship changes and communication difficulties. After a stroke or brain injury, your relationships may change. There may be altered roles, a loss of equality in your relationships, and decreased spontaneity. Your partner may now be a caregiver, but supporting a person with stroke or brain injury can be positive and rewarding for a partner. Your relationship with your partner may change. You may require more help with daily activities. However, you may still be able to participate in previously enjoyed activities. You may need to put more planning into intimate activities. Your sexual encounters might be different now, but you can still enjoy them. It is important to focus on what you have and not what you may perceive as a loss. Talking about sexuality and intimacy is a challenging topic for most people to talk about, regardless of the situation. After a stroke or brain injury, you may have more difficulty communicating your needs and wants, and talking about intimacy. It is a good idea to plan for the conversation by thinking about what you want to say to your partner. Your speech therapist can help you with expressing your thoughts. Now I will talk about some strategies to help you. Connect with your partner, communicate effectively, find new relationships, return to sexual activity, and conserve energy. These are just some ideas that may help you. Think of ways you can connect with your partner. Consider activities that you enjoy doing together. You may need to modify how you do these activities. However, they can still bring you close together. Some examples include movie nights, cooking together, or playing games together. You may rekindle old interests, share stories, and laugh together. These may help you connect emotionally with your partner or spouse. The author Gary Chapman wrote a book called The 5 Love Languages: The Secret to Love That Lasts. In it, he states that there are 5 ways people show their love, namely, stating words of affirmation, giving gifts, doing acts of service, spending quality time together, and touching each other, for example, kissing or hugging. There is an online quiz that you can take that will tell you what your love language is. Consider completing the quiz to help you better understand how you show and receive love. Your love language may change over time. Effective communication involves talking to your partner, taking time to ask and listen to your partner's thoughts or feelings, using I statements, and using a calm and firm tone of voice. You can communicate with your partner by sharing your feelings and concerns through writing, speaking, and body language. It is important to express your fears and feelings honestly. By using I statements, for example, I feel unheard when you walk away from me, it reduces the blame on the other person. It is important to receive feedback positively by accepting compliments, learning from mistakes, and asking for help when needed. If you get angry, give yourself space and time to calm down. It is important to learn to say no and to understand your limits so that others do not take advantage of you. Like many important tasks in life, meeting someone new can be broken down into smaller steps. You might want to consider what activities or hobbies you enjoy. You could make yourself available by getting out of the house or joining a group. Remember to take care of yourself. You could develop qualities that you admire in others, such as humor, smiling when you're around others, helping others, and so on. Some people who have had a stroke or brain injury want to find someone who is normal. But what is normal? Do you consider yourself normal? Your brain injury or stroke does not define you. There are many people with stroke and brain injuries who live happy, healthy, and active lives with some adaptations. It is important to note that both partners need to consent to any sexual activity. After a stroke or brain injury, a person's inhibition or judgment can be affected. This needs to be addressed before engaging in sexual activity. No one should feel forced or pressured to engage in sexual activity. Readiness to restart sexual activity will be different for everyone. Having fears and anxiety about your sexual health after a stroke or brain injury is normal. Both partners should feel comfortable to explore and discuss their concerns. If you would like help to discuss these issues with your partner, you can reach out to a healthcare provider. Sexuality is more than just sex. There are many ways to enhance or engage in your sexual life. They include touching, talking, kissing, cuddling, massaging, and masturbation. It is important that partners take the time to discuss and creatively come up with new ways to engage sexually with one another. It is important that partners talk and plan for intimacy at a time that is appropriate and comfortable for one another. Authors Masters, Johnson, and Kolodny remind us that the absence of sensation does not mean the absence of feelings. The inability to move does not mean the inability to please. The inability to perform does not mean the inability to enjoy. And the loss of genitals does not mean the loss of sexuality. It is important to conserve energy after a brain injury or stroke. This involves planning, prioritizing, pacing, and positioning. It is important to plan the time of day for intimacy and to allow adequate time for it. You may have more energy in the morning as compared to the evening. It is a good idea to prioritize dedicated time for intimacy by limiting strenuous activities throughout the day. Remember to take things at a comfortable pace for you and to rest between activities if needed. You can try different positions and allow your partner to take on a more active role. Positions that reduce stress on your affected side could be helpful. You can put pillows underneath your knees to reduce pressure on the lower part of your back. You can begin with foreplay and build up the pleasure. You can create a relaxing environment by listening to music, dimming the lights, lighting candles, and keeping the room at a comfortable temperature. If you are incontinent, you might want to use the bathroom or empty your catheter bag prior to engaging in sexual intimacy. It is important to keep up with the medications that your doctor prescribes. In general, avoid heavy meals or excessive alcohol. Be aware of signs of distress like difficulty breathing or pain. Take breaks as needed and stay active to increase your overall endurance and mood. There are many healthcare providers you can speak to about sexuality and intimacy after your stroke or brain injury. They include your doctor, nurse, physiotherapist, occupational therapist, pharmacist, social worker, speech-language pathologist, and psychologist. If you're unsure who to speak with, you can speak to one of your healthcare workers you feel comfortable with, and they can help direct your questions to the right person. There are some books that talk about sexuality and intimacy. They include, but are not limited to, The Ultimate Guide to Sex and Disability by Corey Silverberg, Rekindling Desire by Barry McCarthy, and Sexual Awareness by Barry McCarthy. There is a sexual device manual for persons with disabilities called Pleasurable that might be useful. The Heart and Stroke Foundation also has some information about sexuality and intimacy. Also, you can use sexual aids such as toys and lubricants. If you have any questions, you can direct them to your family doctor or any member of your rehabilitation team. If they cannot fully address your questions, they can direct you to the most appropriate healthcare professional. Thanks for listening to my talk.